discuss probably at this point in our lives, the number one problem that podiatrists see in the office, and that is plantar fasciitis, heel pain. And I am not exaggerating when I say that I can see 10 patients, at least 10 patients a day who come in with plantar fasciitis. Plantar fasciitis is an inflammation of the plantar fascia. The plantar fascia is the arch muscle. So looking on the picture to the right is a perfect picture of the anatomy of what the plantar fascia looks like. The plantar fascia runs from the calcaneus, which is the heel bone, all the way up into actually fibers of the plantar fascia go into the toes. The common area for plantar fasciitis is the medial, and you can see that on the diagram, the medial plantar fascia, not where the arrow is, but back more where it touches or attaches to the calcaneus. So a patient will present and I will examine and I will push or palpate on the bottom of the heel, but more towards the inside of the heel. And typically, if there's classic plantar fasciitis, I can get my thumb or finger on the spot and sometimes can raise the patient off the chair if we really wanted to. Very interesting symptom of plantar fasciitis, and it's sort of is counterintuitive. You've rested all night, so you would think that this inflammation would be better. And you get up out of bed first thing in the morning and you can't even put your foot down because the pain is so severe. That is characteristic of plantar fasciitis. There's also pain. So what happens is you limp, you bear weight, kind of. Some people will ice. Some people will take their Advil or Motrin or Tylenol. And after being on the foot for a little while, the pain will go away. Patient says, oh, I'm better. They put on their walking shoes and they go for their 10,000 step walk for the day, and not knowing that they're just injuring the plantar fascia the entire time. May not hurt until you get back home, take a rest, sit down, watch TV, read a book, and then get back up again and can't walk on the heel again. Very characteristic of plantar fasciitis. The most common initial treatments, and it's always hard for me to tell patients who have gotten into an exercise program and they're all excited, they're doing their 10,000 steps or they've gone to the gym, they're on the treadmill, on the elliptical, but rest. We have to let that tissue settle down. It's an acute inflammation, and it's not going to get better if one continues to abuse it. So we're looking at rest, and the rest can be 2 weeks, 3 weeks, 4 weeks, 6 weeks, 10 weeks, 3 months, long time possibly. Rest. If medically you can take anti-inflammatories such as Advil, Motrin, Aleve, very helpful in reducing the inflammation. Ice bag to the heel, take a big bag of crushed ice and just rest your barefoot directly on the ice for 10 minutes, 2, 3, 4 times a day. Ice is an excellent anti-inflammatory. Orthotics are indicated most of the time for heel pain. Again, a very good over-the-counter orthotic would be helpful. Sometimes physical therapy is needed. We will refer the patient to a physical therapist, and there's a whole range of treatments that physical therapists do to help resolve the inflammation. Stretching, strengthening, ultrasound, all those modalities can be used to help. At-home stretching is helpful. I usually ask that you kind of wait until the acute inflammation has subsided somewhat before you start stretching, stressing, um, the plantar fascia. The common one that most people have heard of is leaning against the wall, keeping the foot, your bad foot, your sore foot behind you, knee locked, and almost like you're doing a push up into the wall, stretching the back of your calf muscle and the back of your heel. It also does stretch the plantar fascia. One of the better stretches, if you can reach over, get your sore foot up on your knee, your opposite knee, reach over and pull, grab the toes and pull, bend the toes forward and then back. So basically pull your toes back towards your ankle. The stretch is felt from the toes. Again, look at the picture, the stretch, the fascia muscles go all the way from the heel into the toes. So when you stretch the toes, you're stretching the entire plantar fascia. As a matter of fact, recently I saw a study, believe it or not, they did a study on the best stretch for plantar fasciitis. And the toe stretch that I just described to you has been found to be the best stretch to help resolve plantar fasciitis. If you look at the the picture next to it, you see that the arrow pointing to the Achilles tendon. Now, the Achilles tendon is it really attaches to the back of the heel, but there are some fibers of the Achilles tendon that actually wrap around the back of the heel and continue on to the bottom of the heel. So when you stretch your calf, and that's the lean into the wall stretch, you're going to feel it more in the calf, maybe the Achilles tendon. You may not feel it in the plantar fascia, but you are helping the condition. We will sometimes inject a corticosteroid, a cortisone shot will be given into the sore spot at the back bottom of the heel for plantar fasciitis. If pain is severe, I will recommend that. We try not to overdo shots, but I know we sometimes can go out to 3 injections. We usually space them about 3 weeks apart. And over time, the steroid injection will settle down the inflammation. Remember, this entire time, you're not exercising, unfortunately. If patients are adamant against an injection for whatever reason, the injection does not have to be that painful. We have little techniques that we use to help reduce the pain from an injection. One of the things we do is we mix some Novocaine with the steroid. So actually, as we inject, we're pushing the little Novocaine that's mixed in there ahead of the needle. So that minimizes the pain. We also have a skin freeze spray that we spray on the foot before puncture with the needle. And I know there are many people are fearful of heel injections, and I promise them that it's not as bad as they might imagine. However, if people are against it, if patients are against it, an oral steroid sometimes is more helpful than a non-steroid, what we call a Medrol dose pack. And some of you may be familiar with what a Medrol dose pack is. It's a packet, if you will, of 21 little pills, prednisone typically, and you taper down. You start with 6 one day, taking it over the course of the day, taper down 5, 4, 3, 2, 1. And after a week of the prednisone, that also can help reduce the inflammation. Plantar fasciitis has become so common. I think back to when, again, long time ago, when I first started practice, and if I saw, 3 patients a week with heel pain, that was a lot. And I think as we have, as a population, we're aging. There are more of us around who are getting older, and it is of utmost importance that anybody who is walking for exercise or is on their feet for extended periods of time must wear a good pair of athletic shoes. When you're looking for a good athletic shoe, I would prefer that the patient go to one of the athletic shoe stores. There's a New Balance shoe store in Sarasota. There's a Fleet Feet store. These people are trained to fit properly, and the patient will say, "Oh, Dr. Katz mentioned New Balance. Look, I can get them at Dillard's for $59.99 instead of going to the New Balance store and spending $129, for instance." The shoes are different. They are not the quality that we like for patients who are active. So spend the extra money and buy a more of a true athletic shoe, walking shoe, running shoe. It doesn't, when I say a running shoe, it doesn't mean that you have to be a runner to wear that type of shoe. If you're a walker, the running shoes give the best support and will help with preventing plantar fasciitis from recurring, or hopefully preventing plantar fasciitis from even starting. Now, there are other causes for heel pain that can be similar to plantar fasciitis. I won't go into them. That's up to a podiatrist to determine a possible different cause. Nerve entrapment sometimes can cause heel pain. Just suffice it to say, pain on the bottom of the heel 9 times out of 10 will be plantar fasciitis.